Hi all my wonderful TM joiners, I'm Priya Mistry, the TMJ doc, and today we're going to be talking about your period and TMJ disorders. Does your TMJD seem to worsen during that very special time of month? Does your jaw clicking or popping worsen, become more frequent? Do you have more episodes of the jaw actually catching or locking during that time of month? Does your pain worsen when you're menstruating? If so, watch this video until the end to find out why that's happening and maybe more importantly, what you can do about it. Before getting right into it, be sure to check out my social media as well as my office website. The links for all of those are listed below. My social media accounts and my office website have more information about TMJD in general, treatment methods, tips, trivia, etc. So there's a wealth of information on all of those, so be sure to check them out. I've noticed that while many of you watching, not all of you are subscribing. So just be sure to subscribe, because if you do so, the interwebs will push this important information out even more and make it available and accessible to people who are actually suffering daily from TMJD. So be sure to hit that subscribe button, the little notification bell next to it. That'll notify you for when my next video will be available to view. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington. At my practice, we're dedicated to taking care of patients with TMJ disorders. This includes headaches, ear pain, tooth pain, jaw pain, neck pain, shoulder pain, clicking and popping noises in the joints, crackling noises in the joints, and even episodes of the jaw locking or catching. So now let's get right into it. So if you've seen some of my previous videos, you'll know that hormones, some very specific hormones actually, are a factor when it comes to TMJ disorders. These hormones include beta estradiol and relaxin. The levels of both of these hormones can fluctuate quite a bit with our monthly cycles. Every single body is unique and different, and these levels can even fluctuate from person to person. Both beta estradiol and relaxin are linked with degeneration inside the jaw joints. Don't panic when you hear the word degeneration. This is usually a very slow process that happens over long periods of time. Additionally, relaxin, which is very appropriately named, relaxes or loosens up ligaments, including the ligaments inside of our jaw joints. So while this can be a great advantage to us while having a baby, the loosening of the ligaments because of the hormone relaxin allows the pelvic bones to loosen up, allows the passage of the baby through the birth canal. So while that can be an advantage during childbirth, it can actually be a disadvantage to have too much relaxin when it comes to our jaw joints. What relaxin can do over time is loosen up the ligaments that hold the articular disc inside of our jaw joints in place. This allows the articular disc to come out of alignment and displace more easily, which leads to clicking and popping noises and can progress to the jaw actually locking closed. For more information on all of that, if that sounded like a foreign language to you, please watch my video, Jaw Joint Noises, Snap, Crackle, Pop. It explains exactly what's happening when that disc comes out of alignment. Another video that explains that really well is called Disc Displacement with Reduction. I've linked both of those videos above and below, so be sure to check them out if you have any questions on what I just said. Many people have reported that the pain associated with their TMJD actually worsens during their period while they're menstruating. I can't actually find a good reason for this. I'm actually finding conflicting articles, conflicting evidence. Some articles say that increased levels of estrogen actually desensitize nerves, which leads to less pain or less sensation of pain, if you will. Other articles will say that pain receptors are actually more active during menstruation, which leads to more sensation of pain. So it's a bit conflicting, and I was actually going to ask you guys, just what do you experience? Do you experience more pain during menstruation? That is what I hear from most of my patients. Or do you experience less pain? Or do you notice no difference in your TMJD during that very special time of month? Comment in the comment section below and let me know. I'd love to hear from you guys. One thing I can say that I've noticed in general is that we tend to clench or grind our teeth with more force, more frequency, and for a longer duration if we are stressed uncomfortable, or in pain. During this special time of month, many of us experience low back pain, cramping, bloating, or we're just sort of uncomfortable in general. This can all put our body in a heightened level of stress, which can then lead to increased clenching and grinding activity. That increased clenching and grinding activity can then worsen our TMJD symptoms. Specifically, this will lead to more pain in the head, neck, and jaw. Lastly, let's talk about what can be done about TMJD worsening during that time of the month. Unfortunately, not much can be done about the hormones that are contributing to the worsened TMJD. We can't increase or decrease levels of specific hormones easily, and even if we could, that could have negative impacts on the body. What we can do, however, is treat the symptoms. To increase joint stability and decrease joint noises, I would recommend the 6x6 exercise. So we can go over this now. For the 6x6 exercise, you bring your teeth edge to edge, and then you open to about 90% of your maximum. And then you come back to that edge to edge position. So I'll demonstrate right now. You do that 6 times a day. That's why it's called the 6x6. What the 6x6 exercise does is it helps to line things up in the joint to help decrease the clicking and popping noises. For more information on the exact anatomy and exactly how that works, you can watch my video, the 6x6 exercise. To decrease pain associated with TMJD, I'd highly recommend releasing some muscles, particularly the key muscles that contribute to the TMJD pain. I'll be going over how to release the masseter, the temporalis, and the lateral pterygoid muscles. So let's start with the masseter. The masseter is a big chewing muscle. It's actually the strongest muscle in our body. It can create the most force compared to how small it is. So it starts underneath the cheekbone and extends all the way to the angle of the jaw right here and the bottom of the jaw. So to release this muscle, you can take your middle knuckles, which are these guys here. You'll place them underneath your cheekbones, press inward with a decent amount of force. Now, before moving downwards along the muscle, go ahead and bite your back teeth together gently. Don't clench hard, just a little gentle pressure is fine. Once you've done that, press inward and then actually run down with that pressure inwards, run down the length of that muscle, all the way down till the angle and the bottom border of the jaw. You can do that 3 to 4 times, 3 to 4 times a day, and it helps to relieve tension and knots that can build up in that muscle. That's one thing you can do. The second is to release the temporalis muscle, and we'll do this in 2 ways. So you can use your fingertips for this one. I find that to be the best. The temporalis muscle is a large muscle and a key player in clenching and grinding activity. The masseter muscle is also a key player in that clenching and grinding activity. So back to the temporalis. So the temporalis starts at the coronoid process, which is a little bony notch on our jawbone, which is about right here. If you actually open and close, you can feel it moving. If you go just right underneath your cheekbone and a little forward to your ear, maybe about 1.5 inches forward, you can typically feel that moving. So it starts there and it goes outward in like a fan shape. It's a big muscle right here. So what you're going to do is grab your fingertips, start at approximately where that muscle begins, and then with pressure inwards, and again, you can bite your back teeth together gently during this, go up and back with pressure inwards. And as you do that, fan your fingers out. If you fan your fingers out, you'll actually get the whole muscle because again, it's a big fan-shaped muscle. So we're imitating that fan shape as we release that muscle. Press inwards and backwards. Lastly, let's release the lateral pterygoid muscle. The lateral pterygoid muscle is tiny. It's about the size of the end of my pinky here, but it is fierce and it can cause a lot of pain and discomfort, including jaw pain, headaches, specific tooth pain, pain into the ear, pain behind the eye, etc. Many people believe that you cannot reach this muscle anatomically at all. Other people believe you can reach it. I guess I fall into the category of believing that you can reach the fascia and the tissue around it if you cannot reach it. So when you release this muscle, you actually have to go from inside the mouth. You're going to start by taking your pinky. So right hand, we'll use that right hand to release the left lateral pterygoid. You're going to turn your pinky so that the pad of your finger is facing towards your cheek and the nail is facing towards the inside of the mouth. Then you're going to go ahead and go in. You're going to go right next to your cheek, and you're going to get your pinky as far up and back as possible between your cheek and your very last teeth back there, and even up and further back. When you go in, you're going to open wide, but once you get about as far back as you can, I'm going to ask you to close halfway. When you close halfway, you can typically go even further back and further up. Once you reach the spot, you'll know, because it's typically painful. This is not an easy thing to go through. It's typically a painful release. And once you get to the spot, I'll ask you to hold pressure there for about 10 to 15 seconds. Then kind of change the angle of your pinky and do it again. So you can do that one maybe 1 or 2 times a day. Take it easier on the lateral pterygoid than you will on the other couple muscles that we talked about, because this muscle is usually kind of angry. So I'll demonstrate that as well. So I sort of demonstrated a quick version of that. So with the Masseter and the Temporalis, you can do each of those 3 to 4 times, 3 to 4 times a day. With the lateral pterygoid, I would limit it to 1 or 2 times a day. Many people have done these releases because they're available on my YouTube channel, so you can look up the videos for each specific muscle that I mentioned. And they have contacted me from around the world saying that these have helped with headaches, range of motion of the jaw pain, etc. So please try these out if you're in pain. I truly believe that they can help you. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJD relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Relief. You'll find that on my office website, which is linked below. As always, questions and comments are welcome in the comment box below. Feel free to let me know if you learned anything from this video, if you found the information useful or helpful at all. If you experience more pain during your period or less pain during your period, I would love to know as well. So again, feel free to comment below. And remember, my friends, you can never have TMI about TMJ. Thank you.